Awesome. Good evening, everyone. Welcome to our Alumni Voices webinar. It is so great to have you join us tonight. My name is Mary Tanski, and I am a member of the Medical Alumni Association Board of Governors and a 2009 graduate of Wayne State School of Medicine. I am so excited to be part of tonight's program, which is sponsored by the Medical Alumni Association. Before I introduce our incredible presenter, I would like to share a few details about tonight's event. You will notice that your cameras and microphones are turned off, so you're welcome to eat dinner or just sit back and relax and listen. You can submit questions using the Q&A button, and we'll do our best to get to as many questions as possible. So now it is my pleasure to introduce my classmate and friend, Dr. Christopher Allen. He is a Wayne State University School of Medicine alumni and a board-certified physician in sleep medicine and pediatric neurology. Dr. Allen is the founder and CEO of Quality Sleep and Neurology PC, a practice that he built in his hometown of Saginaw, Michigan, where he serves patients and families in the community that helped shape him. Many of you may also know him as Sleep Dr. Chris, an educator and national speaker who focuses on the science of sleep, recovery, and physician well-being. Dr. Allen brings both clinical experience and expertise to tonight's discussion. Having trained and practiced in environments defined by long hours, night shifts, and constant demands, he understands firsthand how shift work and sleep deprivation contribute to burnout in medicine. Tonight, Dr. Allen will explore the effects of shift work and burnout on physicians, the biology behind why this happens, and what individuals and systems can do to move towards healthier, more sustainable futures in healthcare. Please join me in welcoming Dr. Allen. Thanks for being with us.
Thank you for having me, and just really excited and very honored, and especially honored with the person that's introducing me. So, Dr. Tansky, Mary, thank you very much. And I just can't wait to talk about this. And I'm going to open the presentation. Just never know when's a good time just to open it. So there we go. Let's see, screen two. All righty. Okay, just making sure I'm sharing the right screen. All right, then once you see notes on there, all right. So let's see. Screen you're sharing. Just double checking. Yep. So we can get ready to start. And so again, welcome, Dr. Christopher Allen. And the title of this is The Effects of Shift Work and Burnout on Physicians, a Vicious Cycle and a Path Forward. And before I start, even though I know this is an alumni webinar, I'm still going to let you know who I am. So again, my name is Dr. Christopher J. Allen. I'm the CEO and lead physician of Quality Sleep and Neurology. And it's in my hometown of Saginaw, Michigan, which I'm very, very honored. And I'm very honored that I share a building with my wife, who also is a Wayne State University School of Medicine graduate as well. And she has her practice in the same office. So not only do we live at home together, we work in the same space together. And I have to say that we don't have joint practices. We have two different practices, and we both and we both share the same building. Yeah. And so also, not only am I a sleep doctor and a pediatric neurologist, I'm also in the sleep, I'm a sleep influencer, which is just a fancy way of saying I'm a content creator that talks about sleep medicine and just talks about how, you can just better your life with sleep. And people know me as Sleep Dr. Chris. So shameless plug, if you go to sleepdrchris.com, you'll be able to see this and see all the great things that I have on there. I'm also on all those social media sites there as well. And then also, since this is an alumni, I'm also a part of class of 2009. And it's funny, I told Dr. Tansky that I was going to find an old photo. And I was like, you know what, this one is fitting since it's alumni. So this is us at our graduation. And so, again, special. But enough of that, and let's get to the talk on what's happening. And then I'll leave enough time where we can have some questions. And so again, I'm a sleep medicine doctor. And so when people hear that, they're like, oh yeah, sleep apnea, sleep apnea. And so I do more than just sleep apnea. And whenever I do a talk, I always like to show a couple of slides just on what I had to go through to be board certified to be a sleep medicine doctor. And this is like our list of what we had to go through. So every time I look at this, I get, reminds me of the blood, sweat, and tears that I have to go through to be a sleep medicine doctor. I mean, it was less blood, more tears. But as you see, of course, we do sleep-related breathing disorder with obstructive sleep apnea, central sleep apnea, also sleep-related hypoventilation disorders. Also, there's neurologic disorders that play a role in sleep. And also, we deal with restless leg syndrome as well. So not only am I a neurologist where I deal with that, I can deal with that, from sleep medicine as well. And then there's more. You deal with parasomnias, which is just a fancy way of saying that you move in your sleep, and then insomnia as well, and then central disorders of hypersomnia, narcolepsy, idiopathic hypersomnia, and some other parts of it as well. And I always like to start with that because, my message that sleep medicine is more than just sleep apnea. I always tell my patients, yes, I am not a sleep apnea doctor, I'm a sleep doctor. So that's I just wanted to talk about that. And so now, look, we've all been here before. Be that it's through med school, through our residency or fellowships, and even in our lives, we've dealt with burnout in one way, shape, or form. And it's very important, and it deal with outside of the realm as just people that work within night shift. And so I know that we've been there, and I like to get a view of the virtual room. So in this past month, just this past month alone, and for the people that are watching, I think in the comments you can just give a thumbs up or hearts or anything from there. But how often have you felt burned out from just your work? So is it rarely, sometimes, frequently, or almost always? And I highlighted B because to me personally, I put sometimes, especially like, around the holidays. And so I had some time off. It probably would have been frequently if it wasn't for Thanksgiving. And so I always tell people that, you have to be real with yourself, and that's my transparency. That burnout happens, and it happened with me as well. And during social media, I have this saying that I do throughout, if anyone follows me or going to follow me, I always give hard truths. The title is like hard truths I would give you if I wasn't afraid to hurt your feelings. And so when I was thinking about this talk and talking to, alumni and people that are at Wayne State University School of Medicine, I'm like, well, I got to bring the flavor of sleep Dr. Chris in here. And so this is the alumni version of things I would tell you about sleep burnout if I wasn't afraid to hurt your feelings. And so here's one of the hard truths. And the first one is that you don't have insomnia. Your nervous system has forgotten what safety feels like because 28 years of call shift trained your body to stay alert and not rest. And why does that happen? Because your body, it has a master clock. And so there's two, when you think about sleep, you have the opposite, being alert. So you have your sleep and you have awake. And with alertness, there are two things that are battling with each other, or not even battling, that goes in a certain that's what I'm looking for. You go in a certain rhythm. So you have your alertness, which is wakefulness. The sun plays a role with it. And then you have sleep, which is regulated by a lot of things, but with melatonin. And melatonin is a hormone in your body. And I know a lot of people take it, but it's your way of your body telling you, hey, it's time to go to bed. And it helps with that master clock as well. And then cortisol promotes wakefulness. And so you have the HPA axis that helps facilitate that. Now, unfortunately, when it's done at the wrong time, that can mess up that master clock. And even body temperatures plays a role. So when you're alert, your body temperature is more warm. When you fall asleep, it starts to cool off. And so that's why I always tell my patients when you're going to bed, make sure to have, like, if you take a shower, make sure it's a little bit right before, it's not too close to your bedtime, because if you raise your body temperature, that can play a role with keeping you up later. And so after 16 hours of continual wakefulness, human performance begins to degrade. That is not weakness. That's a biological feature. And there's many roles that play a role within that. And so you have this shift work that happens. And usually, from all of us that have been through med school and in residency, you had to be on call. And so all of us dealt with shift work one way, shape, or form in our career. And with that, it's the great disruptor. Your body, and you see this line, and this line just talks about when you are going to bed and waking up. It's a line. You have the circadian rhythm. When you go to bed, when you wake up, and like I said, there's many things that helps that. And there's two factors. You have one factor that's called process C, which is the circadian rhythm, where you see the nice little line on the left. And then you have your process S, which is your sleep drive. It's kind of like when you don't eat and your body just gets hungry and it just wants food, it wants food. Well, that happens with sleep. So the longer you stay up, the more propensity you have to want to go to sleep. And that's play with the role of adenosine. And so what happens with adenosine, when it rises in your body, it's just telling your body, like, look, we need to go to sleep. And it gets to the point where you just can't fight it anymore. And there's things that try to block adenosine for that to happen. And one of those things that can block it is caffeine. So when you're drinking your coffee, that's one of the big reasons why when we were studying or you're on your shift and you're just trying to get the extra boost, that's what happens with coffee. It helps that block the adenosine, but then after a while, it goes away, and then the adenosine just flushes, and then you get that crash anyway. But the thing, so that's your process S for the sleep drive. Your process C is your circadian rhythm that's dealt with, it has the cortisol and it has the melatonin. So when melatonin starts to get high, that's when it tells your body, look, it's time to go to bed. And then throughout the night, it starts to get low. And then when you wake up, it starts that system all over again. And then when you are in shift work, that that smooth sailing is misaligned. And as you see in here, there is a lot of impacts that can happen. When everything is aligned, your body is maintaining its cardiovascular, metabolic, and immune health. But unfortunately, when you have shift work, and that's why you have to be very careful on what you do to move forward with it, is that that chronic disruption, it can lead to cardiovascular disease, metabolic disorders, and impaired immune function. And so, even with moderate sleep deprivation, your performance equivalent is being it's compared to being legally intoxicated, which you have slower reaction time, impaired memory, and poor judgment. And so, shift work is something very serious that we have to look at and make sure that we're doing the right things to make sure that it's not misaligned. And so, here's another hard truth. Being hypervigilant isn't a personality trait. It's an injury from training. Medical school didn't teach you to be excellent. It taught you to survive on adrenaline. And if we think about when we were in med school, and we all have our times where we were taking our test or studying for our test and just seeing how late we had to stay up or if we had to be on the floor. And then during residency, being around after being on call. And the thing is that you learn how to maneuver that. And pretty much, that's an intense situation where you're learning. And quite frankly, we were surviving on adrenaline. And the thing is that burnout, it's not a personal failure. It's not. It's an occupational phenomenon. So what's happening when you have burnout? There's a couple of things. You have emotional exhaustion. You have that feeling that you have nothing left to give. And then sometimes during burnout, you can also have depersonalization or cynicism, where you just have this emotional armor through where you're working when you're treating patients or diagnosing, where it's just not feeling the same, or it feels like it doesn't matter, and you feel like you're in a different area from where you should be. And then also like reduce personal accomplishment. What happens? You have the sense that your work no longer matters. And so if you start feeling like you have some of those side effects that are happening, then burnout could be happening. And the hard part about it with burnout, it is something that you look at retrospectively. Like you might start feeling that like, wow, well, what is going on? And you take time to look back, you can see that burnout is something where those three things can happen. And so for many of us, this is being described more accurately is like moral injury. And this is the distress from being unable to provide the care that you know is right due to the constraints from that's happening systemically. So the data doesn't lie on what's happening. So they did this, they had like the data, especially like who experienced burnout more. And so the study showed that female physicians report burnout more than males. So back in 2011, when they did that, it was 45%. 2021, it went all the way up to 63%. And just looking at some newer data that have come out, it still is mirroring the same. And with the specialties that deal with burnout the most are emergency medicine, internal medicine, and OB-GYN are most hard-hitting specialties. Now, the other specialties are, and I thought about putting a slide about like all the percentages. I was like, no, I'll just have the heavy hitters, but it is throughout all specialties. So another hard truth that I have, that second one after midnight, it isn't focus. It's cortisol pretending to be commitment. Stress hormones doesn't equal clarity. They equal survival. And the hard part about it is that, like I said, in your body, you have those two factors that are working and that are trying to align with each other. You have something that promotes sleep at nighttime and then promote daytime. And you have this bridge from a long night to a burnout day. So what usually happens when you have this and from burnout, and the biggest thing like sleep deprivation can lead from it. And that's where it starts. You have sleep deprivation, which ultimately leads to circadian disruption. Also, you have like the HPA axis activation. What happens where that's where the cortisol is coming, and what you're doing from there, you're depleting those energy stores. And when that happens, you lead to your emotional exhaustion. Even though you're trying to push forward, your body, as I was showing a couple of slides back, you're moving on an empty battery. And even though you have an empty battery, there are still things that need to be done, and your body is trying to complete that task, but eventually it leads to burnout. Now, here's another hard truth. Your sleep tracker is giving you anxiety, not answers. Obsessing over REM percentages doesn't fix a broken circadian rhythm. It creates orthosomnia. Now, a lot of people that are feeling burnout, and one thing that I'm very fortunate being in sleep medicine is that a lot of people are talking about sleep now. And the big way that they're talking about sleep is sleep trackers. Like if I did a poll on everyone that's listening or that will listen, if I told you to pull up your wrist and see what kind of watch you have, more times than not, it's going to be a smartwatch. And what happens when you wear that smartwatch overnight? You're going to have that sleep tracker that tells you how you're sleeping. And so a lot of times where I have patients that come in and they talk about being burnt out and figuring out what happens, some people come in with like stacks of paper and showing the data. It's like, well, look over these couple of weeks. This is how my sleep was. Like, well, one night it was 90%. Now it's down to 72. And so that's what happens. And they call that phenomenon that's happening where you think more of your sleep instead of like even if you felt like you had a great time sleeping and you felt good about it, but when you start looking at the data and it tells otherwise, then that starts a whole nother phenomenon. And that phenomenon is called orthosomnia. And that's what a lot of people are using in the research literature as far as like with all these sleep trackers that are happening. And sleep trackers been around for a very long time. They just made it mainstream now. And the validity of it is improving to where it was before I even started sleep medicine. And it's really good about seeing when you're sleeping, but the sensitivity of it when you are waking up, that's what that's what it needs to happen and fix a little bit more. And so when you are trying to figure out, okay, I have burnout. What should I do? Why am I not sleeping well? this watch I'm looking at says that I only have like 5.5 hours. And I always tell patients and my colleagues, you need anywhere from 7 to 9 hours of sleep. And if you're not getting that, it leads to that sleep deprivation that we were talking about from the previous slide. And so you have this downward spiral that is happening. So again, if you have long shift work and long hours, depending on when you're going to bed and not getting that quality sleep, and for adults, it's anywhere from 7 to 9 hours of sleep, you're getting not the correct amount of sleep. And then also because of how you're sleeping, you're getting poor sleep, which will lead to worsening health. And so that's what happens when you have stress, you have anxiety, you have poor cognition because you're getting poor sleep. And when you have that poor sleep, worsening health, it leads to increased burnout, where you have that exhaustion, where you're very cynical or you're very moody. Your loved ones are like, whoa, what's going on with you? Or no, to stay out your way because you had like this long week of being on nights and you're trying to like still do things during the daytime. So you didn't get that poor sleep. And so again, you had your poor sleep, you had your worsening health, then you had your increased burnout, which makes sleep worse. And so again, you can start having, rumination, laying down, just thinking about your night or your shift or what have you, going over and over again. Hyperarousal, so just the tiniest noise will wake you up in the middle of the night. Or if the heater turns on and you just feel like you just wake up very quickly. And then it can lead to insomnia as well. And you have to ask yourself, is it actually insomnia happening? Because when you have these inconsistent sleep schedules, it might not be insomnia, but it can still have cases where potentially it will be insomnia and it starts to perpetuate because you have this cycle that's going on and over again, which leads to this downward spiral. Now, another hard truth. Normalizing chronic exhaustion isn't resilience. It's a public health crisis we're calling professionalism. Running on empty doesn't make you dedicated, it makes you dangerous. And this is one thing that I preach not only to my patients, I talk to that with my colleagues as well, is that, we're in a field where we are chronically exhausted, and you have to prioritize making sure that you are getting good sleep and making sure that when you especially work jobs that can lead to burnout, to make sure that you're moving in that direction to do that. And even outside of medicine, there's something that they call hustle culture, where someone's like, well, if you're not grinding, like if you're sleeping, then you're not grinding and you got to grind. And if anything, it makes it worse. And it makes productivity worse. It can increase accidents and more important, your health. And so I always tell people that, when you're running on empty, it doesn't make you dedicated. It makes it, dangerous. And there's only so many times you can do that. And your body is always fighting itself. And one of your jobs, your body does is to survive. So it's trying to survive when it's going through this. And so, what is the cost of exhaustion? It costs us, it costs our patients. And so, again, if you are exhausted, you are 2 times more likely to be involved in patient safety incidents. And again, I might be preaching to the choir, but I will always say that over and over again. If you are increasing your mistakes, if you feel like you're not as effective as you are, you have to look at your sleep. You have to look at if you are being exhausted. And you can tell from there, not just pushing through. Also, there's a 60% increased odds of having occupational injuries from extended shifts. So, meaning if their shift is over 24 hours. Now, I've been very fortunate to practice long enough to say back in my day, because the way that we had training and the way training is now, I'm glad that there's being some movements to make that better. But, I remember being on that 24-hour call and then being post call and when you are during residency, you might be, you're rounding and then, answering questions from the attending and trying to move forward. And, but, even once you get past that and you are practicing, there's still that increased odds of that happening. And then also there's a 16.2 increased risk of a motor vehicle accident on the drive home from each shift per month. And that's the hard part about this because not only when you're exhausted, it can affect, yourself, it can affect patients, but it can also affect people that had nothing to do with it. And we know that there's been reports and there's reason why we have the stipulations that we have because of people driving home and getting in accidents. And unfortunately, if you really think about it, you either know someone that's had this problem or know somebody that knows someone that has had this problem before. Now, hard truth number 6. Your sleep problem isn't behavioral. It's your nervous system stuck in threat mode. No sleep hygiene checklist can override a dysregulated autonomic nervous system. And from this, what I was talking about is that when you are prioritizing sleep, you have to check your nervous system as well. And that consistency will help. And I'll talk a little bit later about some things that we can do to help that as providers, or even tell our colleagues or even our own patients on what we can do to help that. And the biggest thing about this is that when you're dysregulated, some people think it might be insomnia. It's not. When you're dysregulated, it's going to be, if you have the sleep checklist or you're looking at your smartwatch, that's not going to help until get into that root cause of that. And one of the things that helps your nervous system not be stuck in that threat mode is consistency. And that's the biggest thing. And I mean, here's what we can do to help that. And I talk to people about this, my colleagues, I talk to my patients as well, of things we can do to help along. And one of the things we can do to help reclaim your rest is a couple of strategies. And the biggest thing that anybody can do, and it's the first thing, it's not just the only thing, but it's the first thing, is consistency. And one of the things you can do to be consistent is have a consistent sleep hygiene. And now, sleep hygiene is something that you do when you're in bed to make sure that you can set yourself up to have quality sleep. And so there's this 10, 3, 2, 1, 0 rule that I talk to about my patients. And so the 10, that is 10 hours before bed. And remind you, when I go over this, you can't help but to think about yourself and like, wait a second, am I doing that? It's like, oh, there's no way. But I always tell people, if you don't have any problems, that's fine. If you're going to bed and you're waking up and you're getting that 7 to 9 hours of sleep, then that's fine. But if not, you can look at this and figure out, like, okay, these are some of the tools that I can use to help. And as I said, it starts with the sleep hygiene. And so 10. So 10 hours before bedtime, you should not have any caffeine. And one of the big reasons that we talked about that, again, caffeine can block that adenosine. And what does that adenosine do? It's that building block to your sleep drive telling you, like, look, it's time to go to bed. And so it gives you that sleep hunger, that want. And so if you have caffeine at a later time, that's going to mitigate that from happening. And so if there's problems, and especially if you're working shifts and consistently, you have to keep that in mind. So 10 hours before bed, no more caffeine. And then 3 hours before bed, no more large meals or alcohol. And so again, if you're working and you know you have a swing shift or you have like this consistent shift, and anytime you go to bed, you want to make 3 hours before bedtime because you want to give your body that time to digest. And when you're trying to fall asleep, there's two factors that are going on. And if you're trying to digest and while you're trying to fall asleep at the same time, that can make it not a good night for you to go to sleep and get that quality sleep. When I talk to my patients, I talk to them and tell them, I'm like, all right, what time are you going to bed? What time are you eating? And now, mind you, it says large meals. And so you keep that in mind. And sometimes, and I understand, life happens. So say, okay, 3 hours before bedtime, but like there's a family meal and family dinner, and I want to sit down. And before that, it might be 2 hours before bedtime. um, understand that, and maybe you'll just have a smaller portion and eat a little bit sooner too. So when you know you're going to bed, you want to make sure that you don't have as much food as possible because that can limit that. And then alcohol. And a lot of people, and you probably have heard patients say this, and I know my patients say that, and I always have to correct them. There's like, when they try to self-medicate themselves, it's like, well, doc, when I have alcohol, I go right to sleep. And that might be true. It'll help you like get that sleep onset, but what it usually does, it will chop up your sleep. So it's kind of taking a cleaver and chopping up all your sleep. And so you're not getting that quality sleep, and it's very fragmented with people that are having alcohol. And the thing is, it will mess up your light sleep right before you go into deep sleep. And so you're not getting that good continuity, even though you might be able to fall asleep initially. And they've seen like how a hypnogram looks, where someone that has sleep with alcohol and without alcohol, and you can just see that how it's spaced apart and how it's chopped up as well. And so 2 hours before bedtime should be no more work. And I will give you transparency. This is the one that I struggle with because, when you have a life, and I have two little kids, you want to spend time with them. And then when you're trying to spend time with them, you spend time with them until they go to bed. And then when I say till you go to bed, it's usually that buffer of 20 to 30 minutes where they should have been in bed and you're trying to put them to bed. And then finally, when you get them in bed, you're like, okay, first I tell my wife, how was your day? Because you have to get through that. And then in the back of your mind, you're thinking, it's like, okay, well, now I have some work to do. But when you're doing that, you're ramping up like your mind, and the cortisol, it goes into there depending on what type of work you're doing. So you really have to give yourself that space to like wind down. And again, I'll say this, like I said at the beginning, you do this because I know a lot of people's like, well, that's the time where I'm the most productive. Well, when you have silence and your body's trying to get to sleep and you have that shot of cortisol that's happening and it makes you productive, it can be, but then guess what's going to be affected? Your sleep. And so ideally, you want that 2 hours before bedtime where you don't have any more work. And then it's funny, I'm really good at the top three, but the last ones, I give transparency, and I feel like that's how you are a good doctor, where you talk to your patients and tell them, like, look, I understand, like, this is the goal, but it's, no one's perfect, but this is what you try to reach for and strive for. And, being a physician, you just tell them that. And I think it's just, when you're show that humility in your work to say, like, look, I'm not perfect either, but so I'm not just telling you have to do this, we have to do this as well. And so 1 more hour before bed, you should have no more screens. And it's funny because, sometimes I'll put my foot in my mouth because I'll literally post a video about like going to bed and making sure that you're very consistent. And then my wife will tell me, it's like, didn't you just say no more, like an hour before bed, no more screens? And right now you're posting something. And so, again, we know that it happens. But as I said, if you notice that you're having problems, what you want to do is make sure that you have that window of opportunity to not have any more screens. And one of the biggest reasons why, and you probably heard about this, and even though some screens will have that blue light setting where you can like cut it off, some people won't. And what that'll do sometimes that can affect your body from going to sleep, and it can affect the centers that produce melatonin, which is your body trying to tell you that it's time to go to bed. And so I tell people that, and my patients, when you are having screens and you have problems falling asleep or you have problems with burnout, then What happens is like taking an espresso right before the bed. And no one's going to do that because you're like, wait a second, if I take that, I'm not going to sleep. It's the same with screens. And then something for your rest. And this is a hard one for people, but I stand by it. You want the number of times you snooze is zero. And the big reason why, again, I tell people when you fall asleep, you have anywhere from 7 to 9 hours. And so if you have to wake up at a certain time, you can set an alarm. But when you do, that is shocking you like out of sleep. So if you snooze, then you're trying to go back into that sleep cycle again, then it's going to shock out too. And so that can disrupt your sleep and that can lead to chronic exhaustion as well. And so I always tell people, like, you have the time that you know that you need to wake up. And if you are snoozing, like because, oh, my body's not ready, then we have to work what's happening with the problem. And usually that problem is that you're not sleeping long enough. So someone's like, all right, it's 11:30. I know I got to be up at 5. Well, that's 5.5 hours of sleep. So if you're going to start, well, I'm going to wake 5:15, 5:30, that makes it even worse. And so when I tell people like the time that you have to wake up, make sure you set that time and get up and get out of bed. And so you can get yourself to time to wake up because it'll make you more drowsy during the daytime as well. And talking about the sleep hygiene, I know we talked about the 10-3-2-1-0 rule. Make sure that your room is these three things. It has to be cold, it has to be dark, and it has to be quiet. Now, do this the best you can because if you have a bed partner, your bed partner might likes it a little bit warm because I don't want you to get in an argument. It's like, well, I listened to this webinar and they told me cool, dark, and quiet. It's and the reason why, as we said at the beginning, there's factors that will fight you to stay awake or fight to go to bed. And when you're going to bed, your temperature, your body temperature, your core body temperature is getting cooler. So if you are warming up, that's just telling your body, hey, it's not time to sleep yet. So that's why you want to have it cool. And again, if you're sleeping well, even with this, then that is okay. And again, you want dark. So again, the TV, you don't want on. I always tell patients the bedroom is only for three things. They all start with the letter S. So if you're sick, if you're sleeping, we all know what that S word is. And so if none of those three things are happening, then you're out of bed. And so you want to make sure it's dark and then quiet as well. And again, even if you have to put on like soft music to make it quiet to because it depends on where you live. You might live in an area where you hear outside noises. But you want to make sure that you have that, which will doing that and doing that consistently will help you reclaim your rest. And then there's strategic mitigations that you can do. Because if you're on, like, say, if you're on call, or say that you have to get up and live life where you didn't get that 7 to 9 hours of sleep, you can have strategic napping. And you can do that from 20 to 40 minutes of a protected nap time. That can you promote and improve your alertness and your performance as well. And one of the big reasons why you don't want it too long, and you want it, you either the best way to take a nap is two ways. One, you want to have it between 20 to 40 minutes. And usually it's like 20 and less. And the big reason why you want to, because your body tries to go when your body doesn't know what time it is, it just knows when it's sleeping. And it knows when it tells your body to go to sleep. And there's the factors that we talk about. And when you fall asleep, you start to go into your light sleep. And a sleep doctor will call that your stage one, stage two, or N1 and N2. And while you're sleeping, um, and you get out of that, you're not getting into that deep sleep, which is like your stage three or N3. And when that happens, when you try to wake up out of that part, you're going to be very drowsy and it's going to hurt. And so that's why you want to either have it short, or if it has to be longer, then you put it at 90 minutes so it can go through that whole cycle. Because then what will happen, it'll go to stage or N1, N2, N3, and it'll go back to like N2. And so you'll have a moment to break that. And that's why you'll either do 90 minutes or 20. If you do longer than 90 minutes, your body thinks that it's in full sleep mode and they're going to wake up and feel very groggy. If you're in that hazy mode right in the middle, you're just going to feel groggy too. If that does happen, it's okay. It gets better, but that's why. And so you want to do that strategic napping. That definitely does help that. And then also mindfulness and connection. That what you do in the daytime and what you do to promote yourself for sleep, it will help along the way. And so you can have peer discussions, you can have storytelling groups. It's shown to reduce burnout, and it's shown to also improve the your quality of sleep as well. Which I'm like, oh man, storytelling groups. And I was looking at this, I was like, I have to get into a storytelling group. It's just not for my kids. And so here's one of the other hard truths. The version of you that earned your credentials is incompatible with the version that sleeps well. You weren't rewarded for rest. You were rewarded for override. And we all think about where we're at or how we got here. And this is something that I am also guilty of, where you think about it's like, man, if if I had the fellow version of me working now, I could do everything. But your body wasn't meant for that. There's a point in time where that happens, and even at that time, there could have been things that I could have done better for sleep and to make sure to protect that. And so the older you get, and the part where you are now, you know, you have to put those forward and you have to make sure that you're doing everything to be the version of you now that prioritize sleep, that prioritize having that consistency, and prioritize being thoughtful and mindful so we won't lead to burnout. And that's one of the hardest truths that I had to learn for myself, where it's like, man, because, being a sleep doctor, I read sleep studies, and reading sleep studies is almost like paperwork, where like you get a pack of it, you get it down, and you just get more. And so I think about me in fellowship. It's like easily, I could read like 15 in one day. Now it's like, 15 in one week because, you have other responsibilities that you have. But at that same time, you got to remind yourself that where you were and where you're at now, you there is a difference, and you have to reward yourself of being this person now, where because there's more at stake, especially the older you get. Because you think about your reaction time, your judgment, and all that, that plays a role with prioritizing those things. And so there's a way that we should fix this system. So change is non-negotiable. And when I was training and even starting to practice, they are really trying to fight this, and I will be a advocate to make sure that we continue to fight for this as well. And the thing is, you want to make sure that you have sensible work hours, eliminating shifts that are more than 16 consecutive hours, where they had the report in 2009 talking about that. And it's designed to, and having schedules that are designed to adhere to that circadian science that I talked about at the beginning. You want to make sure that you have enhanced supervision, and implement teams that have like in-house supervision for high acuity settings and to reduce the burden. And then this is just not, I mean, to help burnout, I think just to help life in general, you just need reduced administrative burden. So advocate for ways to help that. Be that if you have AI scribes that help and streamline EHR to give us back time with our patients. And we live in a world where they are coming up with new developments to make this like happen. But all of this is saying that we need a culture change. And that's the best way to fix the system. So, what I went over are a couple of things. That one, biology is not optional. Your circadian rhythm is a powerful force. You need to respect it. And it's a vicious cycle. Sleep loss, burnout, fuel, they fuel each other. So, interrupting this cycle is key. And then the solution is twofold. As I said, practice individual resilience, but we need to talk about having that systemic change as well. So, that is my email address. Again, if you go anywhere and type in Sleep Dr. Chris, it comes up. And if you have any questions, feel free to email me. I do check it a lot. And the last truth, you can't fix burnout with yoga when the systems keep stealing your sleep. Rest isn't self-care, it's resilience. And I always tell people sleep is important. And unfortunately, when you think back on your life and when things get hard, the first thing that people will sacrifice is sleep. But it's something that we need. And one thing I appreciate with pets, they will they will prioritize their sleep. If you have a dog or a cat, you'll look at them. It doesn't matter what happened; they're going to get their sleep. Sometimes we need to take notes from them. And so the first step in heading and healing the system is to give the healers permission to heal themselves. So that's all I got. Thank you very much. And let's see if anybody has any questions.
Thank you so much for that presentation. That was awesome. I think, especially as an emergency medicine physician, I found it super impactful, and I work a lot of nights. And so I think some of these tips and tricks are definitely super high value. I'll take them with me. Um, for the people that are in attendance, if you have any questions, you can feel free to put them in the chat. And I have a couple of questions that were submitted previously that I'd love to ask you, if that's okay.
Oh,
Um,
please do.
the first one is you mentioned cold, dark, and quiet. What are your feelings about white noise?
So white noise is okay, and I tell people that like when you do it, just make sure that it's a nice, comfortable frequency. And white noise is okay, and it depends on what you're trying to drown out. And if you feel like it's getting in the way, then I would just say don't do it. You don't have to have white noise, but if there's a consistent sound, I'd rather have someone have white noise instead of using the TV to fall asleep because that makes it worse. So I feel like that white noise is okay.
Thank you. And we'll go to one that's in the Q&A. What are your thoughts on sleeping with pets in the bed? Does it impact your quality of sleep? And then also, as an aside, asking to reshare your email.
Okay. So, so yeah, so my email again, sleepdrchris@gmail.com. So you put in sleepdrchris@gmail.com, and that's my email. So feel free to email that or go to www.sleepdrchris.com and then it'll have ways to get on there too. And it has all the emails to get in contact with me. But sleeping with pets, it is okay if it's not a problem. And so I always tell people that, like, if I have patients that come in and they're having problems sleeping, I look at their sleep environment and I ask, who's their bed partners, pets included. And if they are having, problems, with that, then I have them say, give a trial without them being in the bed. But if you're able to fall asleep with them in there, then that's okay. And if you feel like, you're having problems and they're in there, I always still say before we put it on, Fluffy or Fido, um, make sure to look at how you're sleeping because it might be a sleep disorder that's happening and it might not have anything to do with the pets. Because the hardest part about my job, I got to talk to people about things that happen to them when they're unconscious. And then, talk to your bed partner. I mean, not your dog, but talk to your bed partner to see what's happening and how you're sleeping. If you're snoring, if they notice pausing breathing, if you're doing some weird or abnormal movements, that helps with your quality of sleep as well.
Thank you. Um, can you comment on your thoughts on melatonin and is it safe?
Okay. Oh, yes. This is a hot button topic because recently there was something that came out. I was like, wait, melatonin and heart disease? I was like, let me look this up. So I'll work backwards. So again, the cool thing about melatonin, we make melatonin in our body. And as I was saying earlier, it does many things. But for sleep purposes, it tells your body when it's time to go to sleep. Melatonin has to be at a certain level to kick that off for you to facilitate yourself going to sleep. So it's not a sedative. And the thing about melatonin, that when people take melatonin, there is a way to take it. And I always tell people when you take it, if you want to take melatonin, you should be taking it with the guidance of your provider, with your doctor. And a big reason why is because a lot of people take melatonin, the wrong dose at the wrong time. And even on the bottle, it says take a half an hour right before bed. You can take up to 5 to 10 milligrams. And the thing is that honestly, you need anywhere from like 1 to 5 milligrams. And they've shown a study where how us as sleep doctors, when we use it, they had 5, 10, 20 milligrams. They all did the exact same thing as the 5 milligram one. And so it's like buying something. If you want to buy something for 5, 10, or $20 and the exact same thing, you're gonna say, I think I'll do five. And so the thing is that I use it. To me, when you're thinking about melatonin, that is that's a clear cut indication that you need to talk to your provider about your sleep or get to a sleep doctor because it's a signal saying that something's wrong with my sleep and I need to do something about it. And with melatonin, there was a paper that came out, not a paper, a presentation about how there might be linked to heart disease. And we live in a world where correlation doesn't equal causation. And it's only one paper where they've shown some people with that. Melatonin is still safe to use. I use it in children and even in adults, but I feel like it has to be within the guardrails of someone that knows how to use it. I always tell people I can I can prescribe chemo drugs, but I'm not because I don't know how to use it. So that's the thing about melatonin. It's safe, but if you feel like people are reaching for it or people are talking about it, two things: wrong dose at the wrong time, and that should be facilitated with a provider that knows how to use melatonin.
Thank you. And then another question, can you comment a little bit on how to manage long hours? Like you had mentioned call, 24 or so hours on call, things that happen with like general surgery residents, for example, and what can be done to help fight sleep deprivation while maintaining safety?
Yes, and so many things. One, understanding, and there's things that you can do with yourself. And the bigger answer to that is it needs to be systemic change where it's safety first to help the patients. But before we can help patients, we have to help each other. That's one of the biggest things, and with them understanding that. But a couple of things. When you are going into a long shift, what you do before that shift matters. So making sure that you get a good rest, usually half an hour before your shift. If you can take a small nap to help that, that'll be fine. And you have to act like your shift is daytime, especially if it's overnight, meaning as much light as possible at the beginning, and then towards the end of the shift, do what you can to not have as much light that is happening. And the things that I said about the caffeine, making sure that you start to cut it off closer to your bedtime. So you have to do that mental math. It's like, look, it's almost 10 hours. I'm up right now, but I know I'm going to go to sleep. I know my body's going to want to go to sleep. So you have to keep that consistency. Make sure that you have like good, healthy meals and have it more at the beginning of the shift, not towards late, because that'll help as well. And then when you're driving home, if it's like daylight and daytime, block that light as much as you can. So that's when you're wearing your shades, you're getting home. As soon as you get home, get some good blackout curtains. Look, if you are talking about working shift and you're a doctor, you can afford some good blackout curtains. If you can't, look, get a blanket and like pin and close it because you need that darkness to facilitate that because you're working something that your body is fighting against. Even though I had like a doom and gloom talking about all the bad stuff that happens with night shift, there is something that you can do to at least help that in that consistency. And you have to be more intentional with it. And that's the hard part about working those shifts. And I remember that. And there's times where I have to do that being a sleep doctor, where I'll go to the lab and I'm like, ugh, life is still happening, but that's what you do. You have to prioritize that. And even though it's a shorter time, you still have to prioritize getting that 7 to 9 hours when you can.
Awesome. Thank you so much. So that's the end of our question list. I want to say thank you to everybody for attending tonight's webinar. Please be sure to check back on our website and follow newsletters to hear about any upcoming webinars and events. And Dr. Allen, thank you so much for sharing your experience and expertise with us. And thank you again to all the attendees. Hope everyone has a great evening.
Thank you.